We did this not too long ago. We had another Q&A about some of the changes that have happened in Oregon and around the Portland metro area that are related to the spike in coronavirus cases that we've seen. Today, again, we have some more changes to talk about. We went from the 2 to 4 week freeze to now what's kind of a different system that maybe looks at those numbers and how we respond to those numbers county by county. Brad, do you want to talk a little bit about what's changed? So we're out of the freeze and now we're into a new system.
Yeah, we are. So maybe we'd start at the very, very beginning, which was back in March when we began stay-home orders. And then in May, we entered a phase 1, phase 2, phase 3 tiered system. And then that's been in effect for basically the entire year up until about a month ago when Governor Brown said she was going to institute what was then a pause, and that was going to be in certain areas. And then she quickly replaced that with what was a freeze, and that was in place for 2 weeks. Now we've entered this new chapter. The new chapter is essentially a 4-tiered system based on risk level. There are 36 counties in Oregon based on either per capita coronavirus case counts over 2 weeks or total case counts for some of the smaller counties or test positivity rates. A county will be assigned into one of 4 risk tiers: extreme risk, high risk, moderate risk, or lower risk. And those dictate what's open in your community and how many people you can meet with.
Great. So let's take Multnomah County, for example. It's got probably the most people in the state. A lot of our readership lives here. And it seemed like that has also been the place that's had a lot of the stricter rules. So does this change anything for people living in Multnomah County?
Yeah, so going from the freeze to the extreme risk does change some things, but not a lot. Of the 36 counties that are all 36 counties have some level of risk. 25 of them are in the extreme risk category, which is the most severe. And so a lot of it sort of looks similar to what Governor Brown outlined. The maximum group that you're supposed to be involved with is 6 people, 2 households. That's the same as the freeze, right? Indoor dining is prohibited. That's also the same as the freeze. You start to see some differences around the edges, frankly. You can now do outdoor dining or outdoor drinks with a friend. You can still go shopping, but the capacity went from 75% in a store to 50%. There's some new requirements on maximum capacity for places of worship, for instance. So in each county, it's a little bit different. And as you scale down the risk level, the more you can do is expanded. And so it's really sort of hyper specific depending on which county you're in. Like I said, 25 counties are in the highest risk category, and that's in the entire metro area. Essentially, every large county in Oregon is in the extreme risk category.
So one question that we have gotten on social media the last couple of days since people started to get information about this is where can they go to find out what tier their county is in? Well, we have a lot of questions there.
Yeah, you can obviously go to OregonLive.com because we have that information, but you can also go to the State of Oregon website. The Oregon Health Authority has links on their COVID page, which then will direct you to a governor's page, and you can see they've got a map that tells you exactly which risk category you're in. But then once you see the risk category, then you have to go to a separate table to figure out what you can and can't do. It's a bit complex, but once you sort of figure out which chart you need to look at, it's not too difficult. And we can drop some links into the feed below for anybody who's interested.
Great. And that's something that as we get information, we're going to update that and have that on Oregon Live as well, correct?
Yeah, we've been doing it ever since last week. The governor, when she announced we were moving into this tiered structure, I think she said there was going to probably, based on the data at the time, it'd be 21 counties that were in the high risk or extreme risk category. And when she announced it earlier this week, it actually turned out that it was more. It was 25.
So, and you may not know this off the top of your head, but of those counties, then that would be what, 11 who are not in that extreme risk. Do we know what the distribution of what risk levels they're at?
Yeah, I can get that for you. Let's see here.
here.
We got, according to the state's website, which is handy, we've got 25 in extreme, 5 in high, 2 in moderate, and 4 in lower. I should add the ones that are in lower are all very, very rural counties. And the moderate ones, there's one on the coast and then one in southern Oregon. The one other thing I'll note just on this metrics is the state, when they first announced how they were going to do this last week, said it was going to be, per capita case counts for large counties over 30,000, and then total case counts for counties under 30,000 population, and then test positivity would also factor in. The state actually sort of revised that kind of quietly. We started asking questions on Tuesday when we realized that some of the test positivity numbers, and it just didn't quite make sense based on how they had outlined it. And we've since learned that they changed it. And so for counties that are 15,000 or less, and there's only a handful of those in Oregon, they're only looking at case counts. So again, it's really sort of a confusing sort of matrix that you have to walk through. But once you take a look at it, it hopefully will make a lot more sense.
Okay. So for people who are living in those larger counties, it's really about the number of people who have tested positive per the population of that county, and then that positivity rate, which is something that we'd already talked about before, because that's one of the metrics for reopening schools, correct?
Yeah, so the metrics, the state's going to place a county in the highest risk category possible based on either the per capita case counts, which they're using 200 cases per 100,000 residents over 2 weeks. And almost all of the counties that are in the extreme risk category are well over that. So the notion that we're coming down anytime soon, based on the trajectory, doesn't seem plausible. We can all hope for it, but I don't know that that's going to happen. And then it is also test positivity. So if a county were to have over 10% of test positive over that same 10-week period, provided it's over 15,000 people, population of 15,000 people, it also would be in the extreme risk category. So it's either or. If you hit that threshold, you're in extreme risk, and then you're going to be there for at least 2 weeks until the new numbers come out.
Okay. So that's actually a good segue. As we have been going through this process, we had a 2-week pause and we had a 2-week freeze that was potentially a 4-week freeze for some locations. This newest set of restrictions, there's no time limit on this one. This is all based on what we see in the numbers. Is that correct?
Yeah, we're going to be in some sort of this tiered risk setting for a long, long time. And every 2 weeks, we're going to evaluate which county moves where. But this is the new normal.
So we got a question from Selena. Selena wants to know, is that confirmed positive cases or presumptive cases? And we actually do get a lot of questions about the difference between the two.
Yeah, so it's total cases, and total cases include positive cases that have been confirmed through testing and also presumptive. To be a presumptive, you basically need to have symptoms and have been exposed to somebody who was tested positive. That's generally how they would categorize it. And there are some skeptics out there who suggest that this is a way to inflate the numbers. And I just want to let people know, if you look at the total number of cases versus the total positives, it's actually harder to do now because the state's changed how it did. But when the state data was available to do this, you would see that 95% plus of the total cases had actually tested positive. So we're talking about 5%, which isn't, a huge deal.
Gotcha. So one more follow-up question on this. I see a few people in the comments asking about masks. We've had a face covering mandate across the state essentially since this started, that there are no changes to that in these new rules.
Nope, still in effect.
Okay. So I'm also seeing in the comments here, people are asking some specific questions about businesses, restaurants, gyms, things like that. Mike, that is your world. So let's talk a little bit about what this means, if anything is going to change for some of those places.
It doesn't look like a lot's changing. Gyms are eager to get back open. And the one concession in the new rules that folks made is that outdoor fitness classes are allowed again. So that's something of a boost for those who don't mind working out outside in December. But broadly speaking, the changes that came along with the freeze are still in place. No indoor dining, as Brad mentioned. The occupancies of stores has gone from 75% maximum to 50% maximum. That's, for most stores, that won't really be an issue. At your grocery store, they might have to limit a few people coming in from outside. You might have to wait outside a little bit. But many stores are bigger. But if you're going to something like Music Millennium in Portland, that could have an impact. It's a fairly small store. Their occupancy numbers might be lower. You might find yourself waiting outside the door a little bit longer. But for the gyms and restaurants that are eager to resume, indoor service, unless there's a change in the calculus, as Brad said, the trajectory of the numbers doesn't look encouraging.
Gotcha. But with the county system now, with the tiers, in some places, if they stay below some of those, the gyms will have a little bit more flexibility about when they can bring people back in.
Yeah, Brad, you could speak more to that, but I think these are very small places. There probably aren't many gyms in some of these counties with very small populations.
Yeah, let me just pull up the gym, including gyms. Okay, so if you're in high risk, you can open with a maximum of 25% occupancy or 50 people total, whichever is smaller. If you're in moderate risk, that number goes up to 100 people, but still it's 50%, whichever is smaller. And then if you're in lower risk, it's 50% maximum for places like gyms. So again, the lower risk you are, the more people you can have in a setting. And it's just really specific on, if you live in County X, you're going to want to look exactly at all of this stuff to bring yourself up to speed. We don't, unfortunately, as much as we'd like to, I can't give you the full rundown of each 36 counties one by one because it's it's a lot to memorize.
Right. And we'll link to places where people can get more of that data for themselves if they're looking for a specific county or a specific place. So Dawn has a question in the comments about salons and the personal services. They were exempted from new restrictions during the pause, during the freeze. Has that changed with these new guidelines?
Nope, it hasn't changed. They're still exempt, so they can operate with the health and safety precautions that the governor and the other agencies have requested.
Great. I've seen a few people in the comments also ask about hotels and motels. Mike, that might be more in your world, but they remain open as far as I'm aware.
Yeah, that's right, isn't it, Brad? There haven't been restrictions around that. I mean,
Nope.
If you have a restaurant in it, no dice, but
Yeah, and I mean, let's talk, big picture about what all this stuff means, right? Again, we are at an unprecedented part of the coronavirus pandemic. We were seeing cases that had never been quite so high. We've actually seen it dip off a little bit over the last few days. The hospitalizations are at or near their peak as well. And daily deaths, November was the deadliest month that we've had in Oregon. So why is the governor suddenly putting these restrictions in place now? Because of all of those things, right? If the hospitals get too full, then people who need care aren't going to be able to get it. That is the concern. And so all of these restrictions that have been put in place are, according to the governor's office and OHA, things that are targeted, things that were well thought out, things that are being done to help limit new cases, which eventually will limit hospitalizations and eventually limit deaths. And so each of these things, it's, they're cognizant of the economic impacts that this has on people losing their jobs. And so, I think they're trying to walk that fine line between how do we help keep the public health safe and how do we not hurt the economy too much. And so some of these places that are staying open, it's because, well, they haven't seen evidence of transmission, or they've decided that keeping those places open are important, whereas other places you can do takeout. So that's kind of where they're coming down on these things.
Gotcha. So that's actually a good segue. Something that Mike and I were talking about earlier. We do have new unemployment numbers for the first time since some of these restrictions went back into effect, and the trend, Mike, is maybe not in the direction that we would want to see it.
No, the number of new claims, newly filed claims last week was the highest it's been since May, and 4 times what it was in a month ago in October. So unemployment is definitely spiking up. The Oregon Employment Department estimated that the freeze restrictions, which went in place, would affect up to 51,000 jobs. And they say that that's, that what we've seen the initial 2 weeks bears that out. The most recent unemployment numbers we have are for October. We won't get November's numbers for a couple weeks yet. That was 6.9%. It was, up until this point, Oregon's economic recovery had been much, much, much stronger than had been anticipated. The last 2 weeks, that trend has reversed, and we're seeing a sharp uptick in people losing jobs. In addition to the newly filed claims, there are a lot of people restarting claims, people who've been laid off earlier in the pandemic who are starting it again. It's particularly worrisome because there are two major federal unemployment benefit programs. One's called PUA for self-employed workers, and one is called PEUC for it's an extension, a 13-week extension of unemployment benefits. Those both expire on the day after Christmas. And so on December 26th, the employment department says up to 70,000 people will be cut off in Oregon, will be cut off from their benefits. That cutoff is separate from what's happening with the new restrictions, but it's just a confluence of events that are happening right now to make this a very difficult winter.
And just to clarify for people who, maybe are not paying as much attention to some of that stuff as we are, those are federal programs. So the state of Oregon does not have any control over extending those benefits.
No, there has been talk as to whether or not the state could find money to create something on its own. Unlike the federal government, the state cannot run a deficit and a budget deficit. And so finding that money means cutting from somewhere else. And so it's difficult calculus. There are some discussions around whether or not there's something the state could do. I think those discussions are at the early stages right now.
Gotcha. So is there anything else, we've hit the highlights here. We've hit most of the questions that we've consistently gotten from people via social media for the last few days. But is there anything else that either of you would like to discuss or make sure that people are aware of before we wrap up?
I mean, I'll just say, if anything throughout this pandemic, we learn more as we go and the goalposts move. It's just a way of life. What we think is, the new standard changes down the road. And so, these risk factors, these risk settings, that's what we're working with now, and it'll probably stay in effect for a while. But if you're following the news nationally, you see these other states, these other jurisdictions or cities or counties going even further. And so, could we see more severe restrictions if hospitalizations don't go down? It's possible. And so, just with what we're dealing with now, I think people just need to realize that, there could be more restrictions down the road if we don't see the progress that the officials are hoping that we will.
I guess I'd say that, the restrictions Oregon put in place in March were far less stringent than elsewhere. Almost all stores were allowed to continue operating. Almost all manufacturing and construction was allowed to continue operating. The restrictions we have in place are less strict even so than that. There's a phrase that I believe The Economist magazine came up with, a 90% economy. Maybe 9 out of 10 things that we're accustomed to doing, we're still permitted to do, or we have found ways to do under these circumstances. So the economy has continued at a relatively strong level. It may be that we're ratcheting back to something like an 85% or an 80% economy. And that spreads the pain pretty widely economically. And that's what we're facing coming into this winter. Like Brad said, even now, the Oregon's cases are relatively mild compared to elsewhere. We could be facing a sharper economic contraction in the winter months.
Well, thanks for joining me. I'm just looking real quickly over at our reader comments here to see if we have anything else that people would like us to address. And it looks like we've hit most of the broader things that that people were interested in. We've got some comments about some specific things that I will drop some links in there to answer people's questions once we're done with the broadcast here. So thanks for joining me. I appreciate you guys taking the time, and we will maybe be back to talk about this again in the next couple of weeks.
Thanks.
Thank you.